Hi, this is Dr. John Payne with Piedmont Reproductive Endocrinology Group. I am the third-party reproduction medical director at PREG. I'd like to talk today about reciprocal IVF for a couple of minutes. Reciprocal IVF is basically where there are two female partners and one partner would like to use her egg to be fertilized, and then the resulting embryo or embryos could then later be transferred into the partner's uterus, which would in essence be treated as a recipient of that embryo. For reciprocal IVF, it's really fairly simple to do. What we have to do is evaluate egg donor's uterus, if you will, the partner that is going to use her eggs, and the recipient or the partner whose uterus is going to carry the pregnancy. And we evaluate those patients in separate ways, where we're looking for ovarian reserve and how might the one woman stimulate to give her eggs, and the other one, does the uterus meet the requirements for carrying a pregnancy, meaning is it structurally normal, are there polyps or fibroids that could be in the way inside the cavity that could diminish the chance for conception, and can we pass a transfer catheter easily through the cervix into the top of the uterus where the embryo needs to be deposited, if you will, so that it can then implant in the window of implantation. So what happens once we do that initial evaluation and you decide to do the reciprocal IVF, we stimulate the egg donor to retrieve her eggs, while at the same time preparing the recipient's uterus to be able to have the embryo transfer. And the way we synchronize the two women's menstrual cycles is that each of them, as they start their periods, begin oral contraceptive pills taken continuously, and once that happens, we're then synchronized. And then it will take approximately 2 weeks for the IVF stimulation to occur and the egg retrieval occurs. At the time that the egg retrieval occurs, the recipient has been taking about 2 weeks of estrogen pills to thicken her lining as if she were to be the one that had ovulated. On the day of the egg retrieval, the eggs will be mixed with the donor sperm that has been selected. Usually intracytoplasmic sperm injection, or ICSI, will have been performed, and on that day you will know how many eggs were retrieved. The following day the embryologist will update you with the progress and let you know of the eggs retrieved, how many were mature, and how many, after the ICSI was performed, actually fertilized and became embryos. So on the second day, or basically the day after retrieval, you will know your embryo number. And then we have to grow the embryos for 5 days to 6 days to see which embryos progress to the blastocyst stage, which is a more advanced stage of the embryo development. And that is the time in which we would like to do a fresh transfer into the recipient's uterus. The recipient, on the day of the egg retrieval, began taking progesterone, usually the morning after, and on the 6th day of that progesterone, which is basically the 5th day after the eggs were retrieved and the embryos created, the embryo transfer will happen. The embryo transfer is really fairly simple, almost like a glorified IUI in a way, in that you come in with a full bladder so that we can use an abdominal ultrasound to visualize the uterus. A speculum is placed in the vagina. The embryo is loaded into an embryo transfer catheter after we've passed the outer sheath, or basically an empty catheter, into the uterus almost to the depth that we want to transfer. We can then pull the stylet out of that catheter, and the embryologist will bring in the embryo out of the incubator, and we pass that embryo through the transfer catheter stylet up into the top of the uterus under the ultrasound guidance. And once we feel that the catheter's in the best place that it could be, the embryo transfer happens by pressing the syringe gently, and the embryo should go out of the end of the catheter into the uterus, and then we'll begin the process of implantation, which may take several days to occur. At that time, after the transfer, we'll then remove the embryo catheter, and the embryologist will take that catheter and make sure that the embryo actually left the catheter and it is empty, and then our transfer is done. You'll rest about 20 minutes after the transfer in our recovery room. We'll then be able to use the bathroom as normal, and we'll go home and take it easy for a few days. So after the transfer appears to be complete, the embryo transfer catheter is removed, handed to the embryologist, who ensures that the catheter is indeed empty and that the embryo or embryos are no longer inside the catheter and the embryo transfer is complete. You're transferred to the recovery room where you rest about 15 or 20 minutes, but then able to use the bathroom as normal, get your discharge instructions, and then go home and take it easy, at least that day, maybe a couple of days, and hopefully in 12 days we have some really good news of a positive pregnancy test, and we'll then be able to follow the quantitative HCG labs, usually about 3 labs over a 2-week time period to make sure that the pregnancy is actually progressing early on, and then about 4 weeks after the transfer we'll be able to do a transvaginal ultrasound and hopefully see a pregnancy in the uterus with a heartbeat, an appropriate size, and we'll look several weeks later, and then we release you to your OB doctor, or graduate you, as we like to call at PREG, to them for further care. Again, I thank you for listening on Reciprocal IVF. This is Dr. Payne, and we look forward to seeing you at PREG. You can call to make an appointment at 864-232-7730, or make an appointment online in a number of ways, including pregonline.com, our social media outlets such as Facebook, Instagram, and Twitter. Thank you and have a great day.